Hi! So, has anyone seen Agent Carter? Agent Carter? Agent Carter? Agent Carter? But seriously, watch Agent Carter. In the first episode, Peggy manages to throw off her boss by just saying that she needs a sick day for lady problems. The boss doesn't even bother to check in what those lady problems exactly are because he doesn't know and he doesn't want to know. Actually, the lady troubles that she was suffering from was the systematic oppression of marginalized groups such as the female sex. But today I'm going to give you a couple of medical lady problems that every male and female should know about. So let's start with the first lady trouble that all vagina owners start out with: menstruation. The average age for starting that is 12, and when you stop getting a menstruation you're around 55, so those are a lot of years to be stuck with monthly bleeding. You know, you have the usual pain. Apart from the bleeding, you get stomach cramps, backache, you can even faint from the pain, you can get nausea, you can get a headache, the list is endless. If you're unlucky, you'll get hyponuria, which means that you get more blood loss for a longer time. So not only is the Niagara Falls falling perpetually into your panties, but it's also going on for more than a week. If you're really unlucky, you'll get amenorrhea, which means that you don't get the menstruations at all, which could be explained by a long list of health problems. So even when you're relieved that your menstruation is no longer there, it could actually mean that a lot more stuff is going wrong in your body. Polycystic ovarian syndrome, Asherman syndrome, hyperprolactinemia that could be caused by a brain tumor, other chronic illnesses, the use of some medicine, the possibilities are endless. So whether you bleed or not, it's going to be one pain in the ass. So then you go, you know what, I want to have more control of this, and I'm starting to get to the age where I actually get laid. Anticonception. So the anticonception pill is fine, but at first it can get you bloated, it can make you emotionally unhinged a bit. You know, you have those stop weeks while you're using it, and then all hell can break loose. Basically anything can happen, so your friend could have a really good time on the pill, and you could be having the worst time of your life. So how about an IUD then? An intrauterine device. Well, first you're gonna get an STD test because we don't want to pull all kinds of bacteria and stuff up your uterus. So after you got your swab, you can sit down, spread your legs, and just try to relax while someone pushes the IUD inside of you. It's never a comfortable experience, I've been told. As soon as it gets pushed through your uterus, women actually feel kind of faint, so we usually just ask them to lay down for a little while because it's that bad. Or you could get sterilized. I mean, some other people will bitch and whine about it. I mean, you're basically a baby making machine who is just throwing out their biggest function. But you know, if you're really cool with it, we'll get it fixed for you. You just gotta pay up for it. I mean, you also gotta pay for the IUT. And you also gotta pay for the pill, so anyway, you better have mad money for the next 40 to 45 years, is what I'm trying to say. And just vagina problems, man. Every vagina owner has had this problem once in a while. Just the look of it, there's fluid coming out of it, the smell of it, the taste of it. Vagina owners usually get told what the genitals are supposed to be like, and very often it's a very unrealistic perspective. But you know, it's still not a consult just to make sure that you're not a weirdo. Then you got the pelvic inflammatory disease, when an STD or some other kind of infection goes up to your uterus and your ovaries and just lets all hell break loose. I mean, the pain is comparable to an acute appendicitis or a rupture of an organ. That's pretty hardcore. But you know, you fix those problems, you got off your anticonception, all your genitals are clean, you just want to get a baby. But you can't. For over a year. So then we got those individuals with fertility problems. Sometimes the conception problem is because of the male factor, and sometimes the conception problem is because of the female factor. I usually notice that moms blame themselves a lot more often. So then you got all those artificial insemination, ICSI, IVF, and then you got pregnant. Nice, congratulations. But it's not over yet. During your pregnancy, you can get anemia, you can get hypertension that will lead to preeclampsia, There are a lot of hormonal changes going on. You can develop diabetes or hypothyroidism, a lot of emotions, a lot of stress on your body, carrying a lot of extra weight with you. And then there's also the thing that you got a 15% chance of a miscarriage. Or one day you suddenly got to get rushed to the hospital because you got extreme abdominal cramps and it turns out that you had an EUG. Okay, fast forward, menopause. For a lot of women, it feels like the end of their femininity. I mean, you know, they already got the aging, the wrinkling, the growing older, the growing gray hairs. And as soon as their menstruation stops, everything gets drier, especially down there. So it's also a lot harder to have sex without pain. But you know, you muddle through, you're grown, you got your needs. But then one day, suddenly you start bleeding again. And nobody believes that the sands of time have rewinded on you, so... Cancer. Your cervix, your uterus, your ovaries. Any kind of bleeding could actually mean that you got cancer down there. What about breast cancer though? That's a woman's thing, right? Yeah, I mean, I'm not gonna say only women get breast cancer. Yeah, in comparison to that, in the United States and the UK, male breast cancer represents between 0.5 and 1% of all breast cancers. So it's very rare in males. Yeah, okay, so what are typical male problems then? STDs, erectile dysfunction, and a bigger prostate. So good luck, women and vagina owners alike.